The information contained on this platform represents the opinion of the host and shall not be understood, construed as, or a substitute for medical or health advice. Please see a health professional who is aware of the facts and circumstances of your individual situation.
What's good, 365ers? My name is Britt Daniels, your fit life coach, yogi, and entrepreneur, and this is the Black Health 365. As y'all know, it's our mission to be champions of truth and change by providing y'all with personalized self-care information and resources from trusted professionals. We are here to empower the Black community to make healthier choices all year long. So I'm really excited to have this conversation with my beautiful co-host.
Greetings and salutations, 365ers. Jackie Page here, a radio personality in Atlanta, Georgia, and fitness coach. Welcome to the Black Health 365 podcast. We want to go ahead and kick things off with check-ins. But before we get there, because we want everybody to be a part of the check-in conversation, I do want to introduce our guest who will be joining us today. Her name is Marquita Nelson. Dr. Marquita Nelson, put some respect on her name, okay, period. She is an assistant professor of medicine in the Division of Hematology, Oncology at the University of Tennessee Health Science Center and the Belz Medical Director of the Methodist Comprehensive Sickle Cell Center. Whew. Dr. Nelson, how are you doing today?
I'm doing great. Thanks for having me, guys. This is awesome.
Glad to have you, Dr. Nelson. So we like to start the conversation off, kind of checking in and see how everybody is doing. So I will give the floor to you. And these check-ins are like mental check-ins, physical check-ins, spiritual check-ins. So how are you doing? Checking in. How are you feeling?
I'm feeling pretty good. I am a new mom. So I have a son who's 5 months old. So honestly, that's a big adjustment. Trying to balance my life, being a mom, work, being a wife, family. So it's a lot. But I think, as he's getting a little bit older, we're kind of getting the swing of things. And so although I'm perpetually tired, I'm feeling good. This cold weather though, I'm ready for it to go back. I know you guys are in Atlanta. Memphis is also cold. And I don't think I was quite ready for that cold snap.
Yeah, first and foremost, congratulations. That is huge. Completely understand the being tired piece. I'm not a mom, but I'm always tired. So I can only imagine when you add a husband and a child in the mix of working, how much extra tireder, I just made up a word, you are. So, kudos to you because you're also a doctor. So I can only imagine, okay, you wear multiple hats. But as you were saying, yes, I am currently in Atlanta and it is it's cold. Where did this come from? It's crazy. Britt, how are you doing? Are you cold too?
So funny. I'm absolutely cold. Got my sweater on. It's surprising that how should I say this? I am equally surprised each year in Washington, D.C. how cold it gets. We know it's 4 seasons, but it still hits hard every year. And with that being said, Jackie, just checking in on my own side, it's a season of transition. And so on the last 4 podcasts, I've been talking about how my business has been growing. It's been very abundant. Things are happening fast. But now I am very intentionally trying to settle into softness and chill out. But in doing that, I have to step up my boundary setting and tell people no. Because there are still things that people want to do with me, a lot of community activations. But I've been struggling here and there, being patient with people, giving them grace, and also setting boundaries. What's going on with you, Jackie?
Well, first and foremost, can we talk about this season of softness? I wonder if a special person has something to do with that.
Absolutely. Love my life.
I had to get it in there. But I'm pretty good. Winding down the year, which is exciting. Let's see what else. I have one more trip for the year planned, going to Jamaica. So I will get out of this cold weather soon and very soon. But yeah, the year is winding down and I'm excited about it. As I've said in a number of podcasts or earlier episodes, really just kind of taking a second to stop and smell the roses, because 2024 looks like it's going to be a really another crazy, but good year. So I'm in a good space, tired because the last few weeks and this week has been a lot, but we're making it. We, as you would say, moving in peace and maintaining. That's where I'm at right now. On top of being cold, I have on the hoodie. It is It is chilly. And speaking of chilly, there's this article I saw, and it was in it was called Outside Online by the National Institute of Human Health Investigators. And they were saying that 15 minutes of shivering is not medically, it is metabolically equivalent to working out for an hour. Britt, what are your thoughts on this? Because I'm like, this is crazy.
Yeah, I think that's that kind of supports the whole ice bath challenges that I've been seeing on social media for the last couple of years. And I think, you know, me and you are both personal trainers. You know, the benefits of getting into an ice bath. I think there are a lot of different benefits to it. It's something
But
that
an
I
hour,
personally want to do.
an hour
An hour and, yeah, I said 15 minutes.
being shivering for 15 minutes is equivalent to an hour of exercise. I just maybe 15 minutes equivalent to like 10 minutes. I just feel like an hour is a lot. Doctor, what are your thoughts on this? Because I'm just like, I mean, I get it, but
First of all, I would like to sign up for the experiment. Like, let me go see if I can replace my workout with shivering. I'm not sure. I don't know what they mean by exercise. Are they talking about low intensity, steady state? Are they talking about HIIT exercise, weight training? I'd like to know a little bit more before I commit. But it sounds interesting.
It would seem the shock to the body to maintain its you know, homeostasis within cold temperature. It sounds like it's saying a caloric. It's causing a caloric deficit. Like your body's putting out energy to you know, to warm itself up, and that's the whole shivering process. So that's interesting to hear. I have heard it before, but I didn't know there was collective studies around it.
yeah, agree. It's something I've heard before. I don't know if I'll be doing it though. I don't really like the cold, so I think
Me
I'm just going, stick it out in the gym and make it do what it do.
It get to moving. You know, it's amazing when I see people do these ice tub challenges and they get in and have absolutely no fear in their face and they're just sitting there comfortably. I'm like, are you guys okay? and, and so yeah, it's not for me either. But from here, I think it's cool we can start to transition to our Dharma talk for the day. And for our 365ers who are familiar, our Dharma talks are a little small sermon to set the tone for the conversation. And I'm really excited to speak about what we're going to talk about today: sickle cell hematology. I'm a Black male who actually has a sickle cell trait. And today's Dharma talk is about how people have struggles that we don't even know about. A lot of people are fighting invisible battles, both mentally and physically. And the expectations that we have of others sometimes may require grace. When we see people struggling, when they express frustration, we simply don't know what people are going through. And it only takes time and space to take a step back and look at, do I really know this person? Why are they frustrated? What are they going through? How can I be supportive? And so I think it's important that as we're transitioning to a new season, depression is very rampant during the colder seasons. It's important that we take a step back and not only analyze ourselves and do inventory, but just extend compassion, grace, and empathy to others. Let's get into the conversation.
I would completely agree with you 110% on that. I probably put this out on my social media at least once a week. Give grace because you never know what somebody is going through, or give grace because we are all dealing with something. And we are all dealing with something. So love that Dharma talk, Britt. Something that I feel like I say on a regular basis. So it's good to, hear other people saying it and that being a message that's been put out. But yeah, let's go ahead and hop into this conversation. Doctor, you are an assistant professor of medicine in the Division of Hematology and Oncology at the University of Tennessee Health Science Center. Can you really quickly just kind of give us a definition of what hematology is? I know what oncology is, but not really clear as far as like hematology goes.
So hematology is the study of blood and blood disorders. So in the root word heme just means blood, and ology is just study. So it's everything blood related, cancer and non-cancerous conditions.
So you dealing with blood, deal a lot with sickle cell, correct?
That's correct.
So what exactly is sickle cell?
So sickle cell disease, it's a group of inherited disorders caused by a mutation in the hemoglobin gene. So the hemoglobin gene is the molecule that carries your oxygen in your red blood cells. And that's necessary for all your tissues to get oxygen. So when you get this mutation in the hemoglobin gene that causes sickle cell, the cells are not like cute little round discs like they usually are. If you think of kind of like a lifesaver, instead they make these like crescent shapes. And when you have these crescent shapes, as they go through your body, they get stuck. And so you're not getting good oxygen flow. You're getting these sticky red blood cells that block up your supply, and eventually that causes low oxygen and pain, which is the most common symptom of sickle cell disease. And moreover, these cells, they don't live very long, and that's where we get anemia. So sickle cell anemia, if you've heard of that, it's because you don't have as many red blood cells, because these cells just aren't great. Your body destroys them because they're just not great functioning cells. So they don't live as long as regular red blood cells.
So taking a step back, you said they don't live as long as regular red blood cells. I guess one, how long do regular red blood cells live? And then how long, or what's the span of the sickle cell blood cell?
So regular red blood cells, they can live for 90 days. And the sickle cells, I mean, it's dramatically shorter. So on the order of weeks, sometimes.
I have even a more preliminary question, actually, just in the study of blood in itself, blood as a function of the body. Could you speak on it and how blood, just for our organism, how does blood sustain our bodies?
That's so exciting. I love blood. So, so blood basically is necessary for everything, because you have your red blood cells, which we're talking about sickle cell disease. So that carries the oxygen. You have your white blood cells, and that's important for fighting infection. If you get a vaccine, that's what makes the antibodies. And then you have your platelets, which are necessary to form clots if you have bleeding. And the blood flows everywhere throughout your body, delivering oxygen wherever you need it. And then all of those special things that are in your blood, like antibodies, are all trafficked through your circulatory system via the blood. So blood is wonderful and super necessary.
Is it true that I hear these, stories? I'm not a medical practitioner. That our blood is blue.
No, it's red.
I don't know if you've ever heard that myth that your blood is blue until it,
yeah,
exposed to oxygen.
It does have a blue tint. If you look at your veins, they look a little bit blue because they have less oxygen in the veins, because the veins are carrying blood back to the heart, and the blood that goes back to the heart has already had its oxygen taken out. So it looks a little bit bluer, but it's definitely red.
Thank you for clearing that up, because that's something I've heard as well. Like, oh, it's blue. I'm like, oh, I bleed blue, red, kind of, sort of.
Well, I'm personally someone who has sickle cell trait, and I'm interested in understanding the difference between sickle cell anemia and sickle cell trait. Something my mother always told me growing up is, baby, if you marry somebody, make sure they don't have sickle cell trait, because it will be an issue. And that's what her grandma told her, and her mama told her. So what is sickle cell trait? And then a question after that, sorry to ask two questions back to back. Why does it seem like I only hear about sickle cell when it comes to Black people? I've never heard of a white person having sickle cell trait.
Okay, so let's start with what is sickle cell versus sickle cell trait. So sickle cell, in order for you to have the full disease, you need to have 2 mutations in that hemoglobin gene. So that's sickle cell disease. And if you only have 1, that's sickle cell trait. Sickle cell trait is thought to be protective against malaria infection. And so if you think about a map of the world, across that equator where it's really hot, that's where malaria is. And so the breadbasket of sickle cell is really in Nigeria. That's where the majority of people have it. But you can also have, we have patients with sickle cell from India, the Mediterranean. We actually have some Latino patients as well. So anywhere where, malaria is prevalent, you will see sickle cell trait. And then as people mate, they like to mate in like groups, people tend to stick with each other. So then you have two people with sickle cell trait, then they develop sickle cell disease. So yes, it is disproportionately affecting people of African and African American descent, but people of all ethnicities can get sickle cell disease.
That's so interesting. I did an Ancestry.com assessment of my family genealogy, and I have a lot of family that comes from Nigeria, turns out. So that's very interesting.
How do I know if I have the trait? Because Britt was saying like his grandmother told his mother told him. That's not a conversation that me and my family had. So is there like a test that I need to take? Is that something that can be found during like regular blood work?
Yes, it's an easy blood test. You can just ask your primary care doctor to test you for sickle cell trait. So in this country, we have newborn screening, which actually screens for sickle cell trait and sickle cell disease. But there's a disconnect between what happens with the newborn screening and then the family sometimes. So, you may have tested positive for sickle cell trait, but you actually don't know that. So I recommend anybody who is curious or planning to start a family, just to go ahead and ask their doctor to test them for sickle cell. It's a blood test.
You were saying that there is a test for babies. Is that something that's relatively new, or has that been out for years?
So we've been newborn screening for years. Most recently, I would say like it's been mandated in the 1970s. But in other countries around the world, they are it's not the same level of newborn screening as we have as the United States. Some countries are just now getting that, as a standard practice. But in the US, we do newborn screening.
I'm interested in hearing about the symptoms of sickle cell in your experience in working with patients. What are some symptoms that you've seen that are most prevalent?
Sure. And so I'll speak about sickle cell disease. So sickle cell trait, you should not have any symptoms unless under some special circumstances.
Right.
Like you're climbing a mountain or a high altitude, you may get some issues. But
really?
Sickle cell disease, yeah, I can tell you more about that, Britt. Sickle cell disease. So the most common symptom is pain. So I like to explain a sickle cell crisis, what we call a pain episode, kind of like a heart attack in your tissues. Because I told you, like, the cells aren't the right shape. So they go in your blood, go in your blood vessels and they get clogged. And so that area doesn't get oxygen. So it's kind of like a heart attack in that space because it's getting blocked off. And so it's extremely painful. And that can happen anywhere in the body. And so the most common symptom is pain, typically in the arms and legs. People experience pain. Commonly, people also have fatigue. And that is due to not having enough red blood cells, which, carry the oxygen. So you're tired all the time. And you may notice people with sickle cell also having yellow eyes and yellow skin, sometimes like a yellow tinge. And that is from the red blood cells being broken down. They release a substance called bilirubin, and that causes that yellow tint. So if you ever notice people's eyes are slightly yellow, that may be related to that, who have sickle cell.
Is that something, the yellowing of the eyes, is that something that I guess somebody who has the trait would also have?
No, they should not, unless they're like Britt. And so say you want to go climb Mount Kilimanjaro. So if you go up really, really high, there's decreased oxygen up there in the mountain. So those are the situations where you may experience sickle cell symptoms because you just have less oxygen.
It's interesting.
But on a day it should be good.
On mountain I've ever climbed that high. I lived in Japan. I climbed Mount Fuji, and I can say I was definitely feeling a little off at the top of that mountain. Are there any other limitations that someone with sickle cell trait should be aware of? Do they get like sick, nauseous anytime? It's not okay.
No, we don't expect people with sickle cell trait to really have any symptoms. There are, there's of course some rare conditions, some things related to the kidney that can occur, but in general, sickle cell trait should not cause any impact in somebody's life.
I'm interested in hearing about treatment now. Once one has been diagnosed with actual sickle cell disease, what does that treatment process look like? Is this a lifelong thing they have to deal with? Are there cures? Are there new technologies working towards cures? What's that whole field looking like?
So it's a huge field and it's really exciting. So for the longest time, we didn't have a lot of treatments for sickle cell. People with sickle cell disease usually died before their 5th birthday. And in the past 100 years or so, we've had so many advancements, including screening. We've learned how to treat infections better. We've learned how to actually manage the condition. So people are living much longer than they used to ever live before. So ideally, if you have sickle cell disease, you have a hematologist. That's super important. So if you're diagnosed as a child, you'll be seen by a pediatric hematologist. And if you're, an adult, you'll see somebody like me. I take care of adults. There are several treatments for sickle cell disease, and it just depends on what what we're trying to treat. We have 4 FDA-approved drugs for sickle cell disease. Until 2017, we only had 1. So we had a big boom since then. And the cure for sickle cell disease is bone marrow transplantation.
Did you say bone marrow transplantation?
Yes. So
Why?
if you think about like your cancer patients with leukemia. So the story is actually a local story here in Memphis. There was an 8-year-old girl who had leukemia, and she had a bone marrow transplant. And she had a bone marrow transplant donor was her sibling. And after the transplant, she was not only cured of leukemia, but she also was cured of her sickle cell disease. And so that's how they realized that bone marrow transplant can actually be a treatment for sickle cell. And it's been an approved treatment as the cure since the 90s.
All right, Jackie, you gotta ask something.
No, you just looked like, because I think we both have the same running thought right now of like, I didn't know that was a thing.
And how is it? How do you transplant bone marrow?
Yeah.
I'm not a doctor. I'm not a medical professional.
Yeah.
Does that person who's giving the bone marrow away, do they lose some capabilities?
They actually don't. It's amazing. And so while we call it bone marrow transplant, a lot of the transplants that we do are not actually taking out your bone marrow and giving it to somebody. It's a little bit more sophisticated now. So what they do is they make the donor make a lot of stem cells. And stem cells are necessary to make like any new cell. So they give you medicine, so you make a ton of stem cells. And they collect those stem cells in a bag, and they save them for the recipient. And then the recipient gets pretty much, they either get chemotherapy or something else that makes their bone marrow wiped clean. So they don't have their own bone marrow. And then they put the cells from the donor, like a blood transfusion, they give those to the recipient. And so you can be a bone marrow donor, and really the only harm I would say is time and the experience, going through it, getting blood draws, stuff like that. But you don't lose any capabilities. That's why we are really, really pushing people to register for the bone marrow registry, which is bethematch.com. Because as African Americans, we commonly do not have matched sibling donors. And that is the best donor you can have, because you want somebody whose genetic material is most like yours, so you have a good match. And a lot of us, including myself, don't share a sibling who has the same 2 parents. And so that's why we need more donors who are Black in the registry, because we find that our genetics are more similar, so we can have more donors for our transplant patients. Now, of course, this is not without nuance. They can do transplants with half matches. So like myself, I don't have a matched sibling, but maybe my parents could donate. You know, they do have technology for that, but the best donor for transplant is your sibling that you have two parents to share with.
This is why we talk to trusted professionals, 365ers, because this is information that could honestly save lives. I've never heard of this at all.
Yeah. So please register at bethematch.com. I don't get any, money or anything, but you get a little kit. You donate you do a little cheek swab, and they put you in the registry. I've been in the registry since I was in college. I've never been called, but available if somebody needed it.
I'm blown away right now because, like Britt said, this is something that I did not know existed. I feel like, especially in the Black community, when you hear sickle cell, you hear that it's something that is you deal with the rest of your life. So to hear that there is like treatment and a cure is just kind of like, why is this something that isn't talked about more often? Why is this information not shared more? You would think this would be like yelled at the top of the mountaintop. I'm confused. Why are we not talking about this more often? Why is this not being pushed out more?
There's a lot of reasons. I think that there's inherent inequity in sickle cell disease, just being that it's a racialized disorder in this country. So although these treatments are available, they're not always an option for people due to cost, due to education, knowledge. There's a shortage of people like myself who practice adult hematology across the country. And so I think there's just a shortage of information that's being put out to the community. And so, yes, bone marrow transplant is an option, but it's definitely an underutilized treatment for sickle cell disease. And the majority of our patients are not being transplanted. They are having sickle cell disease for the rest of their life, and they're being treated by, doctors like myself with medicines instead of the transplant.
There it is. Well, coming to the close of the podcast, another question I'm interested in is, are there any other blood disorders out there that people should be aware of?
Yeah, I treat people with all kinds of blood disorders. I don't see anybody with cancer, but anything that you can think of, like anemia, I see tons of patients with iron deficiency. That's probably my number one thing. Lots of women who are in the childbearing age who have heavy periods. So I'd say PSA for that. If you have iron deficiency and you are a Black woman, that is not normal. I think that has been normalized in our community that, I'm anemic, I just chew some ice, no, that's not normal. Talk to your doctor about it, see how they can help you. So I see a lot of iron deficiency. I see people with blood clots. I see people with white blood cell platelet disorders, kind of the gamut, and some other genetic conditions that affect the blood. So anything that's not cancer, that's blood related, that's my area.
One last question. I know some of the 365ers are wondering this. Is there any way to prevent sickle cell?
Yes. So there is. And I don't want this to be like eugenics or, but the way to prevent sickle cell is genetic counseling. So like Britt said, his grandma said, do not get with somebody with sickle cell trait because you can get sickle cell. So I always educate my patients who have sickle cell. Before you decide to have children, you need to know, if you're in a heterosexual relationship, if your partner has sickle cell trait or something that can make your baby have sickle cell. And so the key to this is education, genetic counseling, and family planning. And so I don't absolutely tell my patients, do not get with this person, but I say, you need to be educated in advance before you decide to have children with somebody. So if your child could potentially have sickle cell.
There it is. Well, this has been a very enlightening conversation. A lot of wisdom that's been shared here that I was not privy to. But is there anything, let's say we call this our What's Your 365, that you would like to leave our listeners with, Doctor?
I want to go back to what you said earlier about people living with silent conditions and disabilities. I think that I agree with you 100% about giving people more grace. You really do not know what's going on. Sickle cell is living with sickle cell is so challenging. There's the physical conditions. There's also some mental health conditions that come with it, depression, anxiety. And then there's the stigma placed on it. You know, people are treated like they're, you know, attention seeking, they're drug seeking, you know, they just want pain medicines, and they get judged really harshly. And so I say, just before you judge somebody, just take a step back and think about what they may be going through before you try to label them or treat them harshly, because my patients really go through a lot. And if you sat down and talked to them, you would realize how much they've experienced and the wealth of knowledge they can give you about their life. So I really like what you said about just giving people grace who have those silent type of illnesses where you can't see them on the outside, but they're definitely dealing with them.
Beautifully said.
Yeah, great words. Doctor, if people want to reach out to you on social media, how can they do that?
Okay, so you can find us at the UTHSC Sickle Cell Disease, so that's University of Tennessee Health Science Center. That our Twitter handle is at UTHSC_SCD.
And I think along with that, it's also important to just get some resources. Are there any websites that people can go to get more information about sickle cell and sickle cell treatment?
Yes. So if you want to, you can go to the NIH. If you like more scientific articles, you can go to the NIH.gov and look up what is sickle cell disease. And then if you're interested in advocacy, the Sickle Cell Disease Association of America is a wonderful organization made by patients, families, and hematologists, social workers, etc. So that is sicklecelldisease.org.
Doctor, thank you so much for sitting down and chatting with us today. This was definitely an enlightening conversation. I think both me and Britt learned some things that we didn't know. So if we learned something, I know the 365ers did. So thank you again, 365ers. If you have anything that you want us to cover, find us on Instagram at Black Health 365. Again, that is Black Health 365. Slide in those DMs. Let us know what you want us to cover, what you want us to talk about, what you want us to bring some awareness to. We got you. You can find me on all social media at Love Jackie Page.
And you can find me on all social media at profitfitness.life. As always, it is your responsibility to be an advocate for your health. Peace, namaste, and love. Thank you, doctor, for coming on.
Thank you.